Up next we have the topic of the translation of the vertebral bone. In previous video we have talked about what is roll gliding of the joint movement or the bone rotation also. Next we talked about the rolling and gliding separately, that what is rolling and what is gliding. Next we talked about the direction of glide. So direction of glide, in direction of glide we talked about the concave or convex gliding. Next we talk about the abnormal roll gliding. Now we are start our discussion with the point of translation of vertebral bone. Bone translation is a linear movement of the bone along a defined axis in the respective plane. So during the translation of a bone, all parts of the bone move in a straight line, which are equidistant in the same direction and have the same speed. Next we have longitudinal axis bone rotation. Translation, sorry. So the separation of adjacent vertebra, pulling them away from each other, approximation of adjacent vertebra, pushing them toward each other. Sagittal axis bone translation. In sagittal axis bone translation, ventral dorsal gliding means the parallel movement of vertebra in relation to each other in the ventral or dorsal direction. Next we have the frontal axis bone translation, which means the lateral gliding, parallel movement of the vertebra in relation to each other to the right or left. Up next we have the joint play associated with the bone translation. So a bone translation produces isolated traction, compression or gliding joint play movements in relation to the treatment plane. These translatory joint play movements are essential to the easy, painless performance of active movements. The arrow in the figure represents the passive joint play movement used for testing and treatment of joints. Up next we have the vertebral motion, or also which is also called the mobile segment. So the superior and the inferior vertebra and all related anatomic structures including the invertebral disc, two apophyseal joints and various soft tissues. An example of vertebral motion segment is the third cervical vertebra C3 situated above the fourth cervical vertebra, which is C4. So the nomenclature used to describe this union is the C3 or 4 motion segment. Up next we have the junctions or translational segments. So a junction or translational segment is an area where one region of the spine is joined to the different region. What are the examples are we have chronic cervical. Next we have the thoracolumbar and the lumbosacral junctions. So the first junction is also known as the segment or OA. So the cervical thoracic junction is synonymous with the C7 or T1. Next we have the physio psychological motion, which each of 24 vertebrae means that 7 cervical, 12 thoracic and 5 lumbars, which is sum up is equals to the 24 vertebra, have the ability to move in 3 planes of reference. Up next is sagittal plane motion, includes forward bending or flexion and backward bending or extension. Next, the frontal plane motion includes the side bending or lateral flexion to the right and left. And the horizontal plane motion includes the axial rotation to the right and left. Next, we have the motion axis. So each of these 6 spinal motions can be considered rotations, forward and backward, bending or rotations about the x or horizontal axis. Like side bending is a rotational about the z or y or vertical axis. The thumb, index and the middle finger. Okay guys, let's drop our discussion over here with the motion axis. In next lecture we are going to discuss the details of the motion axis, like how motion axis work, shows us in the diagram. So that's it for today's guys. Thank you.